You have to ask yourself why this hustler from Chicago is so anxious to push $1 trillion plus healthcare overhaul, which I call a Soviet-era healthcare system, in the next 2 weeks. What's the rush? If it's such a good plan, why not give people time to analyze it and digest it? Why is this man forcing it down everyone's throats so fast? In order to answer this question intelligently, we have to go to experts who really know what's in the plan. We have such an expert. Robert Moffat has been a veteran of Washington policymaking for more than 25 years. He is the director of the Heritage Foundation's Center for Health Policy Studies, so he knows what he's talking about. Dr. Bob Moffat, welcome to the Savage Nation.
Hi, how you doing, Mike?
Bob, I want to focus on one element of this 1,000-page document, and I know you've read it all. What about people like myself who want nothing to do with the government doctors, and I say, you know what, no thank you, I'm going to see my own doctor. How's that going to work? Are they going to let me do that?
Well, I mean, you may be able to find a doctor outside of the system, perhaps. I don't know. A lot of the details have yet to be filled in because you're dealing here with legislative language. Legislative language in this business is not enough. As you know, Mike, what happens is that the Congress transfers to the Secretary of Health and Human Services an enormous reservoir of regulatory power. And oftentimes what will happen is the bureaucrats at the HHS will write rules to determine how the bill would actually be enforced. But I will tell you this, in both the House and the Senate bill, you are going to be required by law to buy a federally approved health insurance package.
Well, I understand. Let us say I don't buy it. Then they're going to fine me. It says 4% of my gross income if I don't sign on to the Marxist health system?
They will. That's exactly right. They will impose a penalty. In the Senate bill, it's a penalty.
So in other words, I cannot see a private doctor because there aren't going to be any? Is that more or less what you think is coming?
Mike, the thing is, they know this. I mean, most of us get health insurance. Most of us basically finance health care through insurance.
Let me go to my case because I can't understand the whole world. I have a PPO, which I pay a lot of money for. And I have a large number. I can actually see almost any doctor that I wish. Or if I've been cut my hand, I had to go to an emergency room. I went and they reimbursed me. My own health plan does up to a certain amount. Is that going to all go away?
Not necessarily, but the thing is they'll make it so hard for your doctor to practice medicine independently that very few physicians will do it.
So in other words, we're going to have a lower quality doctor than we already have, just as in the Soviet Union, doctoring was one of the lowest professions, not the highest. So we're going to go from Ben Casey to something on the order of, an orderly in Mao Zedong's China with a stethoscope? I mean, really lousy doctors, in other words? Dumb people who just want to be a doctor?
I think what you'll have is that if you have a situation where your medical profession is subjected to bureaucratic rulemaking in Washington, and they control reimbursement. They will reduce reimbursement for doctors primarily because more people will be in the government health plans. What will happen is that a lot of people who would otherwise be in medicine will choose some other profession. And unfortunately, the bad news is that an awful lot of very highly qualified and highly skilled physicians will say, look, I've lost control of my profession. I've lost control of the independence of my profession. The profession no longer has the independence and integrity it once had. I'm going to look for another line of work. And I think that's a very serious concern. And I'll tell you why, because it's already happening in Medicare and Medicaid. Right now, if you're a low income and you're dependent upon Medicaid, you have a hard time finding a doctor. And the problem is that kind of cancer, that economic cancer, could spread to the entire system.
I once had a wealthy friend in England 20 years ago, and when I visited him, if he got sick, he went to his doctor, a private doctor. Certainly they had socialized medicine in England 20 years ago. He lived in London in a flat on St. James's Square. He was a wealthy man. But he saw his own doctor. In other words, there was a government plan, and then there was a private practitioner plan. You don't think we're going to have that here?
If you look at the House and Senate bills, there's no independent insurance outside of federal control. I mean, you're going to have...
So you're saying it's even worse than the socialized medical system in England? Is that what I'm hearing? We're actually going to have a Cuban-style medical system where you go to a government-mandated doctor or nothing?
What you're going to have is you will have a system in which most Americans are going to get their coverage. Most Americans are going to get their coverage through government programs, whether it's a new government health plan, which is what the House and the Senate bills would both create, or Medicare or Medicaid. The Lewin Group, which is probably the top econometrics firm in the country, looked at the House bill and they said under the incentives that are built into the House bill, that about 113.5 million Americans would be pushed out of their private health insurance into the government plan. So basically, most of health care will be delivered, through the government system. Now, there are, it's conceivable, that you would have doctors who would work on a cash-only basis. They would be subject still, however, to the extent to which, state regulation or federal regulation allows.
Why does Obama and his Chicago minions want a Soviet-style medical plan? That's what they're pushing here. Why are they so desirous of this? And I have the answer to it. It's not about providing medical care for the poor. It's to control people from the cradle to the grave. If they have your medical records and you have to go to them for everything that you need, not only do they know everything about you medically, but they can control you medically through your medication and through your medical care. This is worse than anybody can imagine, in my opinion.
In your opinion and in mine, the issue here has never been the cost of health care or the quality of health care or covering the uninsured. We can all do that. There are a lot of bills that have been introduced in the House and the Senate that can solve a lot of the problems of the current health care system. But frankly, I think you're right. This is not about cost and quality and access and improving the system. It's ultimately about power and control. I've thought about this, frankly, Mike, I've thought about this for years. I could never understand why somebody would want to get involved in such a very complex sector of the economy. Frankly, you'd think it was full of all kinds of, it's very complex, and you can really make serious mistakes. This is an area where the law of unintended consequences can go berserk if you do the wrong thing. But they want to do it. They want to do it. They want to expand government control over the financing and the delivery of healthcare system, of healthcare. And they do it in both the House and the Senate bills.
So in other words, it takes more power into fewer hands. And as I say, medical records will no longer be private. It will be anyone in the government system will be able to access it. And how come this privacy issue is not coming up in these debates? How come the issue of total power and control over people isn't coming up in any of the debates? Why are the Republicans dead on this issue?
Well, actually, to be honest, to be fair, I think the Republicans have actually in the Senate have been doing a good job. If you look at what Senator Enzi did recently this week, he offered a lot of amendments. They had over 300 amendments in the Senate bill. And the Republicans in the House don't have the same access because the rules in the House are very, very different. It's going to be what Nancy Pelosi and the Democratic leadership want. I think one of the reasons why they're going to try and move this thing so quickly is because I don't think they want people to actually read these bills.
No, they don't. The reason they're steamrolling this is because they know the more people look at it, the less they're going to want it. They're going to recognize that it's a government out of control with a few people controlling their lives. And so, therefore, nobody seems to be understanding what's at stake here but me and you and a few other people who understand that these dictators are going to get control of our lives from cradle to grave. Anybody can access your medical records, including your psychiatrist, your psychologist, or any such records, can control you. They can blackmail you. They can manipulate you. Don't people understand the dangers of this?